Hey, have you heard about it? A small group of healthy young adults will be deliberately infected with coronavirus today. Wait, what? No way, they must be crazy. No, I'm serious. Let me explain it. These 18 to 30-year-old adults are involved in a project called the Human Challenge. It involves deliberate exposure of human volunteers to infectious virus. A small syringe filled with live virus of the very beginning of March will be squirted up their nose, and then doctors will monitor their conditions to gain a greater understanding of how the virus affects people and help support the pandemic response by aiding vaccine and treatment development. So, Chirs Chiu, the leader of this Human Challenge trio, explained all the questions that you may concern about.
We have a lot of experience conducting these studies safely. Like I said, I've been leading a research group for 10 years doing this type of research, and it builds on experience in the UK and in the US and parts of Europe for many decades. We are conducting this study at a leading UK London hospital, and these individuals will be very closely monitored throughout. So I think we're doing everything we can to make this as safe.
Dr. Chiu emphasized that the new variants are 99% identical to the March-dominant strains, so it doesn't change what scientists understand about the disease, but can be safe and well tolerated in healthy young adults.
I think for this kind of study, what we're trying to understand are the fundamental, general principles of the disease and the immune response to the disease. And that really should be the same, whether it's young adults or older adults.
The new and high-tech vaccines still need to be clinically tested, but with public health measures, there is not so much natural transmission going around.
Vaccines become more widely used. It's going to be less and less easy to test those vaccines in large-scale field studies, unless you use a system like Human Challenge, where you have a very guaranteed infection rate, and then using quite small numbers of people, you can show whether a vaccine has effectiveness or not.
So now, I guess you are more familiar with this project. I still have a last question. Are volunteers paid? They are not paid, but everyone is given about £4,500 across the whole of the year-long study for the time commitment.